Hello, today is January 7th, 2021, and my special guest today is Dr. Dan Coe. Dr. Coe is an internist at Silver Cross and has been on our staff for 21 years. So first of all, thank you for all those years of service. Today, Dr. Coe would like to share a personal story with all of you. He was diagnosed with COVID-19 on November 25th. And because of his experience, he wants to emphasize how important it is to get the vaccine. So let's explore his story a little bit. Let's start with, what were your initial symptoms?
Well, the night before Thanksgiving, I started having fever, chills, body aches. It was something very similar to what many of my colleagues and patients have described to me. If you've ever seen the movie Spinal Tap, it was as if someone turned up the pain volume to 11. So all my old aches and pains hurt, but you had all these new body aches all over as well.
So it was an 11 on a pain
scale? Oh, it was 11.
Scale.
Oh, absolutely.
So even before you got tested, because you're a doctor, you knew.
Oh, yeah.
You knew.
Oh,
and
yeah.
then when did you get tested?
The Friday after Thanksgiving,
Okay.
and it came back positive as expected.
Okay. And you have been extremely conscious wearing PPE. I see you here at the hospital. So how do you think that you contracted COVID?
Oh, I know how I contracted COVID. My wife, Kit, who is a Loyola physician, does see COVID patients at Loyola. And a family that she encountered called their office a few days after she saw them, stating that they had all tested positive. And of course, I was actually quarantining, or rather isolating, from my wife in the basement. But unfortunately, it was too late.
It was too late. And from the communications you and I had, you had a rough time of it.
I had a terrible
nasty.
time.
Yeah.
The first 4 days, I thought I was getting over it. And then on day number 5, the toilet got flushed, and I started to have congestive chest symptoms.
Scary.
Started coughing, started having hearing and feeling crackles in my chest, especially if I would lay down. I kept holding off on the high-dose steroids, though.
Yeah. But did you consider hospitalization at some point?
I was probably a day away from crawling here to the emergency room.
God. Well, I would have come and got you. So, having gone through this really tough experience, what would you say to your patients and employees and just everybody in the community about the vaccine?
Oh my gosh, in no question in my mind. I have to wait 90 days after a COVID illness to get vaccinated, but you can bet that after 90 days I will get vaccinated.
Good.
I will definitely get vaccinated. And again, it's a matter of self-preservation. We know that you can get COVID again, and we're starting to see repeat offenders, so to speak, coming back with repeated cases of COVID after about 6 months here at the hospital.
And why else should people get the vaccines? You said self-preservation. I know you think there's a couple other reasons.
Well, we want to protect our patients. Just like the reason we get influenza vaccination is, to protect our patients, and that's one of the main impetus for having a mandatory immunization program for influenza here at Silver Cross. Although it is not yet mandatory, I think that it's extremely important. We want to protect our patients. But if we want to have our communities, our churches, synagogues, temples, our educational communities, our families back, recreation, if we want to have our world as we knew it a year ago back, it's important that the majority of us get vaccinated.
Right.
We want to protect our elders.
Yeah. So there's a lot of fear out there. And you and I were just talking about the New England Journal of Medicine had a recent article. Can we dispel some of those fears?
Yeah, I mean, this is under such a microscope. I have never lived through a vaccination launch like this, where basically everything is under the microscope and there's so much transparency. And at this point, and it's worldwide, at this point in the United States, we've had over 1.9 million people getting the initial vaccinations. There have been 21 cases of severe allergic reactions, absolutely no deaths.
That's very
And,
important.
and you know, if someone has a history of multiple allergies or anaphylaxis, the guidance out there is to be observed for about 30 minutes
Yep.
After vaccination. And absolutely, there's no reason not to get vaccinated.
So today we got the second dose of Pfizer for the people who were originally vaccinated 21 days ago. And we are having people wait 15 minutes after getting their shot just to make sure they are okay. So we added that in for this round. But so far, so good. Yeah.
Yeah, did you get your second dose?
I did.
Oh, okay.
Right before you came in, I thought, you know what, I better get my second dose.
How'd you do with the first dose?
To be honest, for the first dose, I was fine. I was very tired when I got home at night, so my arm hurt a little bit. By the next morning, I was fine, and I'm sure I'll be fine tonight, too.
Well, I have it on good authority. That sounds better than COVID.
Well, thank you. And, you know, thanks for sharing your personal experience with us. It really means a lot, and I hope everybody will consider what Dr. Coe had to say. We will have more clinics in the weeks to come, so we have a waiting list right now. Please, please sign up. Thank you.
Thank you, Ruth.